University of KwaZulu-Natal's medical student Mohamed Hoosen Suleman says that vaccines and therapeutics are among the best tools that we have in dealing with the pandemic. He also says that misconceptions and fake news about vaccines are rife and deter us from achieving a public health response. Right, let's hear him speak more about this as he unpacks some of these misconceptions and fake news. We welcome you to our program. Thanks for joining us.
Good afternoon to you and the viewers. Thank you for the invitation.
Yeah, well, most certainly. I mean, like we know that vaccines have been developed, prior to this, maybe 10 months ago. So then people have been concerned about the efficacy of this, and doubt came especially with the halting of the first rollout of AstraZeneca. So when it came about, people started being very, very pessimistic and apprehensive about the vaccine. But then after that, there was hope when they heard that Johnson & Johnson was going to be rolled out, as we have seen the process now unfolding of frontline workers being vaccinated. So far, what is the level and the gauge of pessimism around the vaccine and the misconceptions that were touted around before?
Quite interestingly, the most common reason that people cite for the vaccine hesitancy is that the vaccine was created too quickly in a space of approximately 10 months. This does not mean that there were shortcuts in the process. It's an emergency process. An emergency situation warrants an emergency response. And pharmaceutical companies and the scientific community at large have focused all attention and resources into the making of these vaccines. And I think if we understand the nature of these processes, then only will we fully appreciate the work that is being done to ensure the safety and the efficacy of the vaccines. So the scientific and the ethical, so the integrity of the clinical trials, they were not compromised in any way. You get preclinical trials, which are done in the laboratory and on animals, and you get clinical trials which are done on humans. All of these trials test for the safety and the efficacy of the vaccine. Once the vaccines have passed these stages, there should be no real concern, really.
So, Mohamed, sometimes when a study has been conducted and the results come as positive, one would assume that, firstly, if there was a pilot study conducted and there were volunteers who took the vaccines, at least those people would have to testify that they took the vaccine and they have spent so many months or days or nights after the vaccine, and this is how they're feeling right now, so that we can hear it from the horse's mouth. Before we can even talk about the rollout program publicly, we haven't heard that. Don't you think that this lack of evidence based on from the horse's mouth is the one that caused people to be apprehensive, to doubt, because they've never ever seen anybody with the results of the vaccine, whether they are positive or negative, or whether they're still healthy, so that they can say, hey, I'm South African. I took the vaccine 3 weeks ago, and I'm here, I'm still okay. You can take a vaccine as well.
Yes. Those who have had the infection in the past and they've recovered, they should still opt for the vaccine. Remember, you are still susceptible to reinfection, and it remains uncertain for how long it's the body's immune response that will protect you. New evidence it's emerging all the time, and it's believed that if you infected the first time around, you are protected for a period of approximately 3 months. So if you're infected with the virus and you recover, so in the body, there are antibodies, and in particular, neutralizing antibodies. These remain in the body. But when these drop to undetectable levels, that's when the individual is now susceptible to reinfection. And for that reason, to receive the vaccine, it will afford you protection from future infections. So I think that in the best interests of your health safety, it would be more prudent to take the vaccine, even though you have previously been infected.
Right. So there was an issue, members of the public hearing fake news and some conspiracy theories about these vaccines. But right now, are fears allayed in as far as these vaccines are concerned? And do you think that there is public confidence that anytime, anywhere, they would take the vaccine now, whether there were conspiracy theories before?
I think yes, because the issue stays that about the side effects of the vaccine, that's where all the hesitancy comes from. But I think when we understand that the side effects that we experience, pain at the site of injection, slight fever, tiredness, these usually occur in the first 2 to 3 days, and they subside a week after your vaccination. I think it's important to highlight that the side effects are quite normal to experience, because remember, you are introducing it's a foreign agent into your body, so the body has to react. It's no cause for concern. So the side effects indicate that the body is now being prepared to produce that immune response. That's exactly what we want. So the side effects associated with the vaccine should definitely not prevent us from wanting to take the vaccine.
So now, for somebody who is still doubtful about taking the vaccine, what would you advise them?
I think it's quite unfortunate that we have people today who are against science and the evidence that we have there, because evidence-based medicine it's something that we have to rely on when we are fighting the pandemic. Let's listen to the science. We cannot make vaccines and the therapeutic agents our enemy. They help us, and they have been doing so for quite some time. They have been scientifically proven that they are safe and they are effective. And this was done through the preclinical trials and the 4 phases of clinical trials. And when it comes to the vaccine acceptance, I think that there's usually 4 groups of people, right? And the first group are those that really want the vaccine. They believe in the science and the medicine. Group 2, they are not sure if they should take the vaccine. They would rather wait for the others to take it, and then they would make a decision. Group 3 are those that would refuse to take the vaccine. Group 4 is the challenging group. Why? Because these are the anti-vaxxers. Not only will they not take the vaccine, but they will persuade others to also not take the vaccine. So I think we have to focus on the anti-vaxxers, because they prove to be a challenge insofar as our public health response is concerned.
All right. Thank you very much for making time to speak to us. That's Mohamed Hoosen Suleman, who is a University of KwaZulu-Natal's medical student. Thank you very much for your time.
My pleasure. Thank you.